Okay, we're going to be looking at part 2 of physical activity and health. We're looking specifically at exercise for physical well-being. We'll be looking at a few key parts in this unit. Firstly, hyperkinetic disease. What does that mean? What does that include? And then we'll talk specifically about cardiovascular diseases, obesity, diabetes, and osteoporosis. So, hypokinetic disease. What does that mean? It's a fancy word for a lifestyle disease. It's a health condition that is caused or worsened by a lack of physical activity. So, when you're inactive, what can happen? What disease can you get? What diseases are you at higher risk of? So we have cardiovascular disease. This includes heart disease and stroke due to insufficient exercise. For type 2 diabetes, remember there's 2 different types of diabetes. We'll go over the differences between those 2 types and then look specifically at how type 2 diabetes increases, we have increased risk for type 2 diabetes due to low physical activity levels. We'll look at obesity and weight gain and the related health issues from a sedentary lifestyle. So remember, sedentary is almost the same as physical inactivity. It's just a lot of sitting down, a lot of watching TV, a lot of video games. And then finally, we'll talk about osteoporosis. And osteoporosis in the most simplest form is the weakening of bones, or how your bones become brittle due to low physical activity. So hyperkinetic disease, something interesting here is we're comparing the deaths and the cause of death of people in 1900 versus in 2010. So in earlier days in the 1900s, the main cause of death was infectious diseases. You can see there in the big green. But today, death is mainly caused due to these hypokinetic diseases, these lifestyle diseases. We have longer lifespans today compared to in 1900, and we have better treatment of infectious diseases. So that's also likely the culprit behind the rise in heart disease and cancer and obesity and these lifestyle related diseases, now that people are living longer and less worried about these simple infectious diseases, which could be things like pneumonia, tuberculosis, etc. People are in a much more likely position to suffer from these problems of lifestyle. So let's talk more specifically about how a modern sedentary lifestyle is the major cause of hypokinetic disease. More than 80% of adolescents and adults worldwide do not meet the recommended level of physical activity. So it's a massive percentage. And the average adult spends around 6 to 8 hours a day sitting. So if you compare that to our sedentary guidelines, we're sitting for far too long, and we're sedentary for far too long, and too many people don't meet the physical activity guidelines. So in today's age, the population has definitely become more sedentary compared to the 1900s. We have increased screen time. We've got technology like computers and smartphones and televisions that has led us to spend a lot more time sitting and a lot less time engaging in physical activity. We have changes in transportation. So we have cars. We're so reliant on cars and buses and trains for commuting and just running regular errands, like going to the shopping center to do your groceries. We don't really walk and cycle as much. Well, people still do, but it's far fewer people who walk or cycle for transportation. We also have entertainment now. So we have a lot more sedentary leisure activities like television, playing video games, and that's led to a lot more time spent inactive. So sedentary behavior is definitely rising in the current age. Now, something interesting is thinking about smoking versus inactivity. Which one's worse for your health? Now, we know that smoking is really bad for our health. There's been so much in the media, on the news, just so much education about why smoking's bad. We obviously know that inactivity is bad as well, but it doesn't seem to be focused on as much. And there was a study that looked at the prevalence and deaths of smoking versus inactivity per year. And even though smoking is generally considered worse for health than a lack of exercise, both smoking and inactivity account for around 5 million deaths each year. The benefits of physical activity are often highlighted, but we don't often talk about the dangers of inactivity as much. So this in no way is saying that it's okay to be smoking. It's just to be saying that inactivity and the lack of exercise is really bad, and generally it's just as bad as smoking. So the first hypokinetic disease we're going to focus on in this unit is cardiovascular disease. Now, cardiovascular disease is an umbrella term. There's many different things that fall under this umbrella of cardiovascular disease, and we're going to look into hypertension, coronary artery disease, and stroke today. So let's begin by delving a little bit deeper into hypertension. You should all know by now that hypertension is high blood pressure. It's when our blood pressure is above 120, or in this example, above 130 over 80. There's a few different cutoffs of that of what is hypertension, what's pre-hypertension. You can go back to the first part of this unit where we had those normative statistics if you want to see. Now, when we're inactive, we have increases in blood pressure due to a few different factors. Firstly, it decreases the elasticity of the heart and of the blood vessels. So I've said before that your blood vessels should be elastic. We want nice, flexible, pliable blood vessels so that the blood can run through the arteries without much resistance. If we have a stiff blood vessel, which occurs when we're inactive, our arteries can stiffen, then we're unable to account for that sort of rush for blood that occurs in that systolic contraction of the heart, and therefore we have this increase in blood pressure. So the stiffness of the arteries increases the blood pressure, and hypertension affects around over 30% of the adult population. So it's very, very prevalent. And again, hypertension is often lifestyle related. So inactivity, poor diet, etc. can all be risk factors for developing hypertension. Now, coronary artery disease or coronary heart disease, this is looking specifically at the coronary arteries. So if you remember back from anatomy, the coronary arteries are what supply the muscle of the heart with blood, which carries the oxygen and nutrients that it needs to contract. So the coronary arteries are the arteries of the heart muscle. So in coronary heart disease, we have a narrowing of the coronary arteries because of fatty deposits, which limit the blood flow to the heart muscle. So you can see in the picture that we've got a normal artery where it's, clear through the middle, there's nothing restricting the blood flow, versus something called atherosclerosis. And atherosclerosis occurs when plaque and fat deposits gather within the opening of the artery and narrow that arterial wall. So if we have a lot of this plaque within our arteries, the blood doesn't flow freely through the arteries and it doesn't get the oxygen where it needs to go. This plaque can end up completely occluding the artery, and that is what happens when we have a heart attack. So no more oxygen can get through to the rest of the artery and can't supply the heart muscle with the oxygen, and that is in a very basic form a heart attack. So we've got this progression, this growth of a plaque. When the plaque ruptures, it forms a blood clot, and then no blood can pass through that blood vessel. Therefore, the heart muscle cannot get the oxygen it needs, and the muscle essentially dies and isn't able to beat. That is a heart attack. So inactivity increases the risk factors like hypertension, high cholesterol, and obesity, which can increase the likelihood of coronary heart disease. And coronary heart disease is a leading cause of death. It accounts for 16.5% of deaths globally. So it's a very prevalent disease. And then we have stroke. Now, stroke generally refers to the area of the brain. However, it involves the blood vessels in the brain, and that is why it's classed as a cardiovascular disease. Vascular referring to the vascular system, our arteries and our veins. So stroke happens within the arteries and the veins of the brain. So what happens in stroke is that blood supply to the brain is disrupted, and this can be through two different methods. It's either a clot or it's a ruptured blood vessel. So you can see those two different things in the picture there. You can have a stroke formed from a clot. So a clot stops the blood flowing through the vessel, and therefore that vessel cannot get any more oxygen. Or we have a rupture where the blood vessel sort of breaks open and the blood spills out, and we've got a bleed within the brain. So again, being inactive increases the risk factors for this condition. The risk factors being high blood pressure, atherosclerosis, which is the plaques forming and the clots forming, and poor blood circulation. Stroke accounts for 10.1% of deaths globally, and it's the second leading cause of death. Okay, then we have diabetes. So you might have seen this slide before in energy systems, but diabetes is a chronic condition that impacts the body's ability to manage its blood glucose levels. There's two types of diabetes, type 1 and type 2. So in type 1 diabetes, the pancreas produces no insulin, and that's autoimmune. That's something that you're born with. So the pancreas is unable to produce insulin. Remember, insulin is needed to allow glucose to enter the cells. So if we have no insulin, it means that glucose cannot enter the cells of the body, which leads to that glucose circulating in the blood and leads to high blood sugar levels or high blood glucose levels. Now, in type 2 diabetes, this is slightly different. It's characterized by insulin resistance. So in this case, the body still produces insulin, the pancreas produces insulin, but the cells are less responsive to it. The cells don't recognize it anymore. And over time, this may also cause the pancreas to produce less insulin, because why would it produce insulin if it's not working, if the cells aren't responding to it? So it can actually cause the pancreas to produce less insulin. So in both types, there's a disruption in insulin's role, and that leads to various complications associated with high blood glucose levels. So let's have a look more closer at type 2 diabetes now. This is the one we're focusing on because this is the lifestyle one. Type 1, remember, you're born with it. Type 2, it's developed from your lifestyle. You can have genetic predispositions to it. So if it runs in your family, you may be more likely to get it, but it is still considered a lifestyle disease. So if it does run in your family, you want to make sure that you've got a very healthy lifestyle in order to sort of reduce your chances of getting type 2 diabetes. So again, like I said, lifestyle causes. It's caused by a poor diet. That's a diet that's high in sugars and fats. It's also caused by a sedentary lifestyle. So sitting down a lot, not moving a lot, can increase insulin resistance. Smoking and excessive alcohol consumption can lead to type 2 diabetes, and excess body fat, so obesity, also leads to insulin resistance. In terms of how it affects health, on the short term, it can cause fatigue. So that's one of the most common complaints among individuals with diabetes. It's fatigue, and that can result from high blood sugar levels, which prevent glucose from going into the cells, to provide the energy needed for daily activities. So if you can't get the energy from glucose into the cells, you can't create the energy needed for your life. Increased thirst also occurs. So people with diabetes often experience excessive thirst, and that occurs because high blood sugar levels lead to increased urination, which causes dehydration. So therefore we want to drink more. And that leads me to my next short-term sort of consequence of diabetes, which is frequent urination. So elevated blood sugar levels cause the kidneys to work harder to filter and absorb the excess glucose. And when the kidneys can't keep up. A lot of excess glucose is secreted in the urine, so you might also have sweet smelling urine. All right, and then the long-term effects of diabetes or long-term complications, these are the more serious complications. So, heart disease. Individuals with diabetes are at a much higher risk of heart disease because high blood sugar levels can damage the blood vessels and nerves that control the heart, which can lead to conditions like high blood pressure, atherosclerosis, and ultimately lead to a heart attack or stroke. A long-term effect of diabetes is also kidney damage or kidney disease. So this is called diabetic nephropathy. High blood sugar levels can damage the kidney's filtering system because the kidneys have to work so hard, and that leads to kidney disease, and over time that can progress to kidney failure, and you might require dialysis or a kidney transplant. Another long-term effect is neuropathy. So diabetes can lead to nerve damage. Neuropathy is nerve damage. High blood glucose levels actually can injure the nerves within your body, particularly in the legs and in the feet. And that may cause pain or tingling or loss of sensation within the legs and the feet as well. It can also cause vision problems. So there's a few serious implications for vision with diabetes. You can have diabetic retinopathy, which is a condition resulting from damage to the blood vessels in the retina of the eye, and that can lead to blurred vision, vision loss, and even blindness if it's not treated properly. Now, in terms of statistics for type 2 diabetes, about 10.5% of the adult population has diabetes, and 6.7 million deaths in 2021 were due to diabetes. Now, you can see on this map that diabetes prevalence is increasing. It's increasing within every single continent, and possibly the craziest one is in Africa, where it's increasing at about 134%. So massive increases in diabetes in Africa, and that might be due to several different factors. Firstly, urbanization. So there's obviously rapid urbanization occurring in Africa, which can lead to lifestyle changes, including more sedentary behavior, increased consumption of processed foods, which can contribute to diabetes and ultimately, contributes to obesity and then ultimately the risk of diabetes. There's dietary shifts occurring, so they're transitioning to diets that are higher in sugars and unhealthy fats and refined carbohydrates, which again increases the prevalence of obesity, which increases the risk of insulin resistance, which increases the risk of diabetes. So you can see how they're all sort of interrelated. And then lastly is an aging population. So in Africa, the life expectancy is increasing at a rapid rate. So people are living longer. And as people are living longer, the number of older individuals increases. So we have more people who are at a greater risk of developing diabetes because they're living longer. If their life expectancy was shorter, it probably meant that they were dying from some sort of infectious disease and they didn't have the time to live to develop diabetes. All right, the next one is obesity. So we've talked about this a little bit in this unit already, but if we go back to sort of a definition of obesity, if we're using the BMI, it's over 30, but remember there's some limitations with BMI. However, BMI is easy to access, easy to measure. You can do it in 1 second on your computer if you look up BMI calculator. The best measure of obesity is to look at body fat. However, this is an expensive, time-consuming measurement that not a lot of people have access to. But if we do have access to a DEXA scan, a body fat of over 32% for females and over 25% for males is considered obese. And 1 in 8 people globally are obese. Of course, obesity is like the number one risk factor for all of these chronic conditions and hypokinetic conditions like type 2 diabetes, heart disease, and also some cancers as well. So the cause of obesity is a positive energy balance. Have a think about what that means. You might have heard it before. It's a big thing on Instagram. People love to say calories in versus calories out. That's generally what we mean by a positive energy balance. It means you're eating more than you're burning. When you're eating more than you're burning, you're going to gain fat, which can lead to, of course, obesity. So we want to make sure our energy balance is neutral. We're eating what we need for the amount of energy that we're using per day. If we're eating more energy than we're using per day, we're going to gain weight. If we're eating less than we're expending, we're going to lose weight. So causes of obesity: firstly, a poor diet, so a high intake of processed foods, sugars, and unhealthy fats. Obviously, these foods are just unhealthy and increase the cholesterol and lipids and sugars within our blood. But also, these foods aren't satiating. So what I mean by that is they're not filling. So it's very easy to overeat processed sugary foods because they don't fill you up. And that's how we can get this positive energy balance, because if we're eating foods that don't fill us up, we just keep eating, causing us to eat more than we actually are using during the day. We also should consider emotional eating there. So eating in response to stress or emotional triggers can make us eat more than what we really need to during the day. We also have physical inactivity as a cause, so sedentary behavior and lack of regular exercise will of course reduce the amount of energy that we're using day to day. So we need to ensure that we're exercising and using that energy that we're getting from food as energy in our workouts rather than just being there and stored as fat. We also have sleep deprivation. This might not be one that you've previously thought of, but poor sleep can affect our metabolism, and it does this through hormonal imbalances. So when we have bad sleep, it disrupts the balance of the hormones that regulate hunger. So we haven't spoken about those hormones, and I'm not going to bring them up now, but when we sleep bad, this can lead to increased appetite and therefore potential weight gain. So important to consider sleep as well when we think about energy balance. But essentially, it does come down to food versus exercise, calories in versus calories out. So if we look at some trends in fat mass for boys and girls during adolescence, this graph here goes up to 60, but I want you to pay particular attention to 0 to 20 years old. We can see that boys and girls start with a similar amount of body fat from 0 years old. That lasts until about 10 years of age. And then unfortunately for girls, that's where we tend to gain fat mass. And during puberty, we tend to gain around 1.14 kilograms of fat mass per year. Boys, your fat mass decreases by around the same amount per year. So you can see that in the graph that the boys, the dotted line, actually has this decrease from about 10 years old to 20 years old. Now, there's a few different reasons for that, mainly being that at puberty, boys have a rise in testosterone, and testosterone helps to metabolize fat. And girls are going to gain fat again for reproductive purposes. If we look at early to late adulthood, what we notice is that body fat actually accumulates during the 30s, 40s, and 50s. So as we get into our 30s, we tend to gain more body fat. And you can see that back on this graph here, that both lines for the men and women from about 30 years old are just on a steady rise upwards until around 60 years old. So body fat does accumulate. And what's really interesting is that when we accumulate body fat as we get older, the body fat that tends to redistribute. So it's almost as if our subcutaneous fat, the fat under our skin, becomes visceral fat, which surrounds our organs, which is the bad fat. And this is especially prevalent in men. And men as they age, a lot of men typically present with that beer belly type body shape, and that can be from carrying too much visceral fat around the organs and inside the body. So you can see visceral fat is around the organs, subcutaneous fat is under the skin. Now, carrying too much visceral fat can be extremely harmful. It's linked to a higher risk of type 2 diabetes. It's linked to insulin resistance, heart disease, and cancers as well. So what's the cause of this accumulation of body fat during adulthood? In order to answer that, we need to look at physical activity trends across the lifespan. So again, we've got age on the x-axis, and then let's just say this is the amount of physical activity on the y-axis. So at 0 years old, we're not doing much physical activity. There's a steep rise in the amount of activity that we do in childhood and adolescence up to around 20 years of age. Then it's stable across the lifespan for both men and women. And then from around, let's say, 60 years old, we have this decrease. We return to this sedentary lifestyle at older age, and that's due to many reasons. We might have joint pain and injury that prevents us from doing things, so there's plenty of different reasons why physical activity might decrease as we get older, but this is the general trend in the population, that this decrease does happen from around 60 years old. So we've seen that older age is associated with less physical activity. It also results in a decreased ability to regulate our energy intake. So with this gradual decline in physical activity from middle to older adulthood, we need to also decline our energy intake in order to maintain our energy balance. Otherwise, we're going to gain fat. So it's been shown that older people have a decreased ability to regulate their energy intake. And this graph here shows that by enforcing sedentary behavior over 7 days, so they got people to be sedentary for 7 days, and those are the squares versus the active people, who are the diamonds. We can see that the squares still ate a lot. They had a positive energy balance. So even though we took these bunch of people and we made them be sedentary for 7 days straight, they were still eating as if they were active. So when we have this reduction in physical activity in our life, it doesn't necessarily induce a reduction in energy intake, and therefore we have this positive energy balance and fat gain. So we have to be really conscious of this as we get older, and that we're doing less activity, so we don't need to eat as much. But this research here, this graph shows that even when we do less activity, we're still eating more. And this might be the reason why we see a steady increase in fat mass during adulthood. So we're doing less and less physical activity throughout each day as we age, but we're not changing our eating habits to account for the decline in physical activity. Okay, we're going to talk about osteoporosis now. So bones, we know they're the framework of the body. We know that they're a living tissue that changes constantly. They respond to the stress that is placed upon them. Bone is removed and replaced by new bone all the time. Just like your skin cells get replaced, your bone cells get replaced as well. So bones are alive. That's the first thing to establish. Now, bone mineral density is the amount of mineral matter per square meter of bone, and it's sometimes also referred to bone mass. It's literally the density of the bone. So the more dense the bone is, the stronger it is, whereas the more porous and brittle the bone is, the more holy it is, the more likely it is to fracture and break. And we know that, like I said before, bones respond to stresses placed upon them. So exercise and physical activity is going to be a determinant of our bone density. The more exercise and physical activity that we're doing, the stronger and denser our bones are going to grow. When we look at osteoporosis, there are a couple of stages. So you can see in the pictures, we have normal bone, which is quite dense, but remember, it's still like a spider webby type structure. So there are a few holes in it, and that's okay. That's normal. Bone loss so the initial sort of bone loss, that stage is called osteopenia. And this is the stage between sort of normal bone and osteoporosis. So osteopenia is like you're on your way to osteoporosis. And we have then osteoporosis, of course, which is defined as a progressive skeletal disease that's characterized by low bone mass and deterioration of bone tissue. And that consequently increases the fragility of the bone and the susceptibility to fracture. So it increases how fragile the bone is and makes it more likely to fracture. Now let's have a look at the normal trends of our bone density across the lifespan. So when we're born, our bones are soft and pliable. They're difficult to break. This is why I'm not sure if you've seen this before, but giving birth, the nurses and the doctors will pull the baby out of the vagina, and they're not gentle with it. They're like pulling it out, and that's why the bones don't break, because when you're a baby, your bones are flexible, they're pliable, they're almost a little bit soft. But that also means that babies can't really sit up or balance, because they have these soft, pliable bones that don't allow them to sit up and withstand their own weight. So as we, grow a little bit older, we're still young, but new bone is formed, and it's formed faster than it's sort of absorbed. So we have this growth in bone mass. The bones become harder and thicker, and that growth in bone mass increases until the mid to late 20s, which is where we hit peak bone mass. And you can see that in the graph there, there's peak bone mass. This occurs mid to late 20s. So 20 to 30 is the key time for this. Now, if we look at peak bone mass specifically, males generally have a higher peak bone mass, and 90% of our peak bone mass is achieved by around 20 years old. So peak bone mass is regarded as a very significant predictor of future osteoporosis and fracture risk. So what that means is that if we have a lower peak bone mass through the aging process, where we're going to lose bone density, we're more likely to reach osteopenia and osteoporosis status faster than someone who had a higher peak bone mass in their 20s, because as you can see, in adulthood, bone mass does decline. So 10% increase in peak bone mass would delay the onset of osteoporosis by 13 years. So it's super, super important to achieve the highest possible peak bone mass by around 20 years old in order to offset that onset of osteoporosis. Now, if we start with a lower peak bone mass in our 20s, that carries on to late adulthood, and peak bone mass or bone mineral density declines at around 0.5% per year after around 20 years old. We have this decline. Now that decline, we can't really change it, it just happens. So we want to be having as much bone or bone mass as possible within our 20s. The decline becomes significant for females after menopause. So you can see in the females, there's almost like a step down at around 50 years old. That's because of menopause. So estrogen is very protective of bone mineral density, and when we go through menopause, we no longer have as much estrogen as we used to, and that is what accelerates that decline in bone mineral density. So it's so important to take care of bone health during adolescence and early adulthood, because this loss of bone mass is inevitable. It's an inevitable process of aging, especially for women. So maximizing the bone mass during growth is essential. So adolescent years, we want to be exercising, we want to be building our bone mass, and we do that through muscle strengthening exercise. So particularly resistance training is probably the best thing for achieving a high peak bone mass, because remember, bones respond to the stress placed upon them. So if we can stress our bones and get them to grow big and strong whilst we're in this peak bone mass period, we're going to set ourselves up for the rest of our lives in terms of osteoporosis. Okay, and Osteoporosis is a very, very prevalent disease. Around 70% of adults over 50 have osteoporosis or osteopenia. So they've either got the full-blown osteoporosis or they're on their way to achieving it. So that's a massive percentage. It's about 1 in 2 for women and 1 in 3 for men. Again, women are more at risk because of menopause and that loss of estrogen. Estrogen is protective of bone mineral content. So when we lose that estrogen, our bones become more porous more quickly. And around 70% of fractures occur in women. So falls, when we get older, are really bad. They can cause a lot of issues. If you fall when you're older and you've got low bone mineral content, it's going to potentially cause a fracture. And this is a crazy statistic written here. It's that half of hip fracture patients do not return to independent living. So half of people who have a hip fracture and go to hospital for their hip fracture don't return home. They either go into care or stay in hospital. So it's really, it's not great. It really affects older people's independence when they have these types of osteoporotic fractures. Okay, if we look at bone adaptation to exercise, this study looked at adolescents and grouped them into active, average, and inactive groups. And you can see there's TH BMC on the first graph and then FN BMC. So TH is looking specifically at the hip, and FN is looking at the femur, so the long bone in the upper leg. So you can see that active males have much higher bone mineral content in the hip, and active females also much higher bone mineral content in the hip. Same thing for the femur. Males and females who are active had greater bone mineral content within that femoral neck. So being active definitely increases the bone mineral content within our skeleton. Okay, so again, here we see the typical sort of bone adaptation across the lifespan. In the solid line, we have the average trajectory, an increase in, so we've got that normal increase in childhood and adolescence, we've got that peak bone mass occurring in the 20s, and then a gradual decline in older age that can lead to osteoporosis as we get quite old. So if we implement appropriate exercise in adolescence, we can significantly bump up that peak bone mass and therefore reduce the risk of fracture later in life. We can also start to incorporate activities and exercise in adulthood, and we can still get preventative effects. However, those preventative effects are of a lesser extent than the effects seen in childhood and adolescence. So super important to be doing some bone and muscle strengthening exercise in childhood and adolescence. We can still do it in adulthood, but it's not going to give us quite the same effect as it would if we just increase that peak bone mass before we get to our 20s. Okay, so this is interesting to have a look at some sports that are generally considered good for developing bone mass, and they include weightlifting, resistance training, rugby, soccer, and there's many more, but essentially any sport that's weight bearing, high intensity, high impact, and has a multi-directional nature. So you're changing direction, you're running around on the soccer field, going this way, then that way. We can expect to see a beneficial effect on bone mass. Remember, bones respond to the stress placed upon them. So in sports where there's no weight-bearing effect, we could see the opposite occur. So let's have a look at athletes with lower bone density. So as examples, swimming or cycling, we generally see athletes with a lower bone density. Not necessarily low as in they're at risk of osteoporosis, but low as in it's lower than the other sports we said previously. So they might still be higher than the average person, but lower compared to some other sports. So there's a few factors that can have a negative effect on bone mineral density, and that's dehydration and the calcium that's lost with endurance-based training. So whilst distance running and endurance training is a distance running in particular, it's a high impact sport, there are negative effects of super long endurance exercise on bone density. So it kind of rules each other out. Any other sports that are non-weight bearing as well, so we already said cycling and swimming are non-weight bearing, so therefore we don't get that load on the bones that's going to cause them to grow bigger and stronger. And then finally, we have sports that have a calorie restriction aspect. So low energy availability. For example, jockeys, ballerinas, some boxers even, but I wouldn't put boxing on this list because it is such a high impact sport. But any sports where we see a severe calorie restriction, we can see with long-term low energy availability that can have really negative effects on bone density and bone health. So if you're restricting calories a lot, you can lose some of that bone mineral content at a faster rate. Okay, so again, I just want to put in the PAR-Q here to remind you, particularly for people with chronic conditions that we've spoken about, the hypokinetic conditions that we've spoken about, if they're starting an exercise plan, they need to be completing this PAR-Q questionnaire. Please make sure that you've had a go at it, you see what the steps are. If you've ticked yes to anything, go on to the next step and see what the process is. Now, another interesting thing I just want to show you is in the prevention of chronic diseases, let's look at exercise versus whether or not there's a preventative drug. So for cognitive dysfunction, this is brain functioning. For depression, for hyperlipidemia, this is high lipids in the blood. So hyper is high, lipid is fats, and emia is blood. Hypertension, which is high blood pressure. Insomnia, insulin resistance, and inflammation are all risk factors that increase our chances of developing a chronic disease. Can we take a drug to prevent these risk factors? There's only a drug for insulin resistance, and that drug is called metformin. But exercise can help with all of these different risk factors. So exercise is so important. Have you ever heard that term, exercise is medicine? That's where it comes into play here. We can also look at treatment of chronic diseases. So let's say you've got a chronic disease now. Can exercise help? For the most case, yes. It's quite clear that sort of that exercise is medicine little saying does work. So for arthritis, for atherosclerosis, cancer, heart failure, dementia, asthma, depression and anxiety, diabetes, frailty. Frailty just means that is like weak bones and it happens when you get older and you're not able to perform activities of daily life. Hypertension, peripheral vascular disease, we don't need to worry about what that is, and stroke as well. Exercise can help treat all of these conditions. If it's got 1 thumbs up, it means it's good for treating that condition. If it's got 2 thumbs up, it means it's great. So particularly depression and anxiety, stroke and arthritis, exercise can do wonders in the treatment of those diseases. And of course, there are drugs which treat each of these diseases. There's medicine that treats each of those diseases, but for example, for dementia, there's no drug that you can take to help treat dementia, but exercise does have a good effect on people with dementia. All right, that is the end of exercise for physical well-being.